In this lesson, we're going to look at developmental considerations for our hospitalized patients. And when we're looking at development and care, what we're looking for is providing all of our care for all of our patients across their entire lifespan, or maybe in any age group that they're in. And the things that you need to keep in the back of your mind when you're caring for your patients, that these developmental theories, they do a couple of things. They offer framework. So maybe what you can expect for your patients. They help to predict patterns. They also help you to understand responses to what your patients are going through, given maybe the life stage that they're in. One thing that you need to consider is maybe the physiologic age of your patient. Consider that versus the cognitive development for your patient. So if you have a patient that has some sort of cognitive disease that doesn't correspond to their age, you're going to need to think about how to take those things into account, like education and compliance and comprehension. If they have a hard time with comprehension, maybe they only comprehend it. Maybe they're 15 and they only comprehended a 5-year-old's education level. Then you're going to need to change how you educate the patient. And many hospitals are going to classify our patients based on their age, which is kind of what we're going to do today. And so when we look at this, we're looking at things like neonates and infants. You also have pediatrics. You have adolescents. And then you have your adults and geriatrics. We've got a lot of ground to cover in this lesson, so let's get started. As you first take into account your neonatal or infant patients, what you're going to need to do is refer back to your developmental theories. And these patients are not going to understand direction. They're not going to understand logic. They're not going to be able to understand reasoning. So you're going to need to involve the parents and educate them. You're going to need to really get them involved in order to promote compliance and education. The other thing you're going to need to do is you need to promote trust and build rapport with the patient, because you're going to be their direct lifeline to care. And if your patient does not trust you, you're not going to be able to work with the patient. If you do work on trust, if you really build that trust with the patient, then you can really promote care and you can provide care for the patient. The other thing that you can do is provide resources for the patient and for the family. So sometimes for parents, parenting classes can really help, especially for those new parents. Other things that you need to consider are like age and ailments. Consider development. Consider the involvement of the parents. The more you get the parents involved, the better your patient's going to be. And as we move into pediatrics, the two common groups you're going to run into are your toddlers and your school-age children. With toddlers, pain is going to be exaggerated. They cry at literally everything. They also lack the ability to reason. So logic, you can't reason with the patient. You can't explain to them why their needle hurt. They're not going to get it because they're not at a developmental age to do that. This is another reason to get the parents involved. If you get the parents involved, you're going to be able to have better successes. They're going to be able to be there to provide support for the patient and also have themselves involved with the patient's care. One thing that you can do with your pediatric patients are using play. And when you use play, you promote positivity, and you also work to build that relationship. So if they have like a stuffed animal, use your stethoscope to listen to the stuffed animal first, and then you show them that you're not going to hurt them. And then you can reach over and take a listen to their heart and lungs at the same time. And then with your school-age children, these guys need routine for sure. So if you have a hospitalized patient, make sure you hospitalized school-age patient, make sure you develop a routine and stay consistent with it. They're also going to be able to begin to reason. They have some logic at this point, very early, so you can start to talk to them a little bit more like a grown-up. Make sure that you're providing praise to them. They really thrive on praise. So if you need to, also you can get a child. They call them child care workers, or people in your facility that work specifically with children to really promote positive patient outcomes. So reach out to those resources, get the family involved, create a good care team for your patient. You're going to have really positive patient outcomes with your school age children. Now, as we move into adolescence, this is going to you run into this issue where your patients can sometimes either be a pediatric patient or they're an adult patient. It really depends on their body size. It's a big player in there, but don't forget that even though like they look like an adult, they still haven't been able to develop all of the adult higher level brain functions. So one thing to remember when you have a hospitalized patient that's an adolescent is they really thrive on peer support. So encourage them to get their friends to visit, talk to their parents, try to get their friends to visit and promote things of interest for the teenager, because that'll really help your patient out. Also encourage them to ask questions, and also promote autonomy. This is a big time period where they're changing into becoming adults and they're starting to make a lot of their own decisions. So if you help them build that confidence and talk to them about, hey, this is what we're going to do. This is why we're doing it. Do you understand? Do you agree? Start to give them a little bit more responsibility. And also with their education, also make them responsible for their own health. Adults can be really, really impacted by stress in the hospital. They worry about things like missing work, and they worry about the cost of being hospitalized. That's a big player. If they're unable to work, they can't provide for their family. So if they need help, try to get them some resources. See what your local community has, what your hospital has, what your facility has in terms of getting them resources, so that they can you can help to belay some of that stress. It can also be stressful for them if they are a care provider. So if they have kids or they're taking care of their own parents, if they're responsible for doing either one of these things, then that also leads to a stressful situation for them. Adult patients also strive for autonomy. This is a big thing for them, and they're reluctant to allow people to help. They feel like they have to be in control all the time, and they feel like they should be totally self-sufficient. And they feel like, hey, I don't need any help. Leave me alone. I can do this all on my own, right? So what you can do as a nurse is you provide positive reinforcement, provide praise when they actually do something correctly, and then gentle correction when they need education. So like, let's say they're using maybe crutches or a cane, or they need to ambulate and you want to help them, just gentle redirection, gentle correction with it. Don't be abrasive. As long as your adults are going to be compliant, as long as they're not facing any barriers. So continue to work with them, educate them, allow them to be in charge, allow them autonomy. For geriatric patients, these guys are going to be really prone to injury. So you're going to have to focus on your fall and injury prevention. This also means you got to stay on top of, you guessed it, skincare issues. Your patients are going to be prone to that skin breakdown. So you need to make sure you're checking over your bony prominences. Make sure you're turning them. Make sure you're trying to offload that. Additionally, they could have some elimination issues. So be sure you're providing them adequate toileting, adequate assistance. Make sure you're getting them up frequently enough. It's also not uncommon to see your geriatric patients have some sort of cognitive decline. So when it comes to education, make sure that you're educating them on a level that they understand. Make sure that you're using the necessary resources like caseworkers or case management, and make sure you're using the family so that they can really help to reinforce that compliance. For example, if you're like, my grandmother just had a stroke and she was really apprehensive about taking any medication because she didn't trust anybody. So my mom had to get involved and be like, hey, this is why we take this and this is what we need to do. So my mom got involved to help my grandma to understand that she needed to take these medications. The other thing that's going to come with your geriatric patients is the complexity of your discharges. You should be thinking about discharge planning from the moment you lay eyes on your patient, but it's going to be more complex with these geriatric patients because they may not be going home. Sometimes you have to send them to places like skilled nursing facilities. That's what this stands for, SNF. We also call them SNFs. If they're going to a skilled nursing facility or they're going to a nursing home, and you got to get other people involved, your caseworkers, case management. You're going to have to discuss things with those other facilities. This is not going to just be like, oh, hey, you come in and you go home. It's going to be more complicated. So just keep all of these things in mind when you're taking care of your geriatric patients. For this lesson, we're really focused on human development. as we look back on those theories, and when it comes to development across the lifespan, we also think about cognition, and we also think about our patients' ability to understand our education. We also focus on this health promotion idea for our nursing concept. Now let's recap. When you're dealing with your patient, consider all the theories. Consider all the theories involved in development. Refer back to them so that you can create a good framework for taking care of your patients. When you're dealing with your infant patients, remember to promote compliance through the parents by getting them involved, and also work to develop the trust with the patients and also the parents. When you're dealing with your pediatric patients, use play. You want to promote the positivity. You want to work to build trust. You want to build that rapport with them. And with your adult patients, they want autonomy. You need to consider stress and use those resources for them to help your adult patients out, so they feel like they're in control and that they have and that you can reduce those stressors that are going to create a barrier for them. And lastly, when you're dealing with your geriatric patients, provide safe care. Consider the complexity of the geriatric population and work on your discharge planning early. You want to work to get that. Planning done so that you can provide all those necessary resources for them. And that's it for this lesson. Make sure you check out all the resources attached. Now go out and be your best selves today. And as always, happy nursing.